Last year's flu season was pretty non-existent according to health experts. They attribute low numbers to people wearing masks and washing their hands more often. But with less masks and more vaccinations, they're anticipating numbers for the flu to go back up, which is why they're encouraging Arkansans to get the flu shot.
Hi.
Hey.
How are you? How are y'all today? Who's going to go first?
Kylie Stout is a pharmacist at Cornerstone Pharmacy on Rodney Parham Road.
We are a little bit busier than usual today with the approval of the booster shots for 65 and older, and also with flu shots starting back.
They started offering the flu shot at the end of August.
We can promote them and they can get both at the same time. Now that's recommended and approved by CDC and ACPAS, so we are able to give them both at the same time.
There was a total of 70 confirmed flu cases last season, according to the Arkansas Health Department. The CDC labeled cases for the state as minimal. Beyond the flu, fall allergies are still a concern with common plants like ragweed.
Ragweed is a plant that is very common here in Arkansas and tends to bloom in the late summer and early fall season. Very commonly when it blooms, lots of people are allergic to it. And then we always worry, is that a sign of COVID or the flu?
Allergies typically don't have a fever or body aches associated with symptoms like the flu. The flu doesn't have shortness of breath or loss of taste and smell with symptoms like COVID.
Over the last 20 or 30 years, traditionally have lost a lot of people to influenza, and certainly we've lost a lot of folks to COVID. So the more people that will get their flu shots and get their vaccinations, the better off everybody will be.
I would recommend it now or into October, just because you want to make sure you're covered now, but also want to make sure it extends long enough because the flu season can go well into spring.
Jade Jackson, THV 11 News.